Hi everyone. Welcome to this interview with one of my, close juniors who we've been in touch. I think since 3 to 4 months back, and then it was very very happy and overwhelming to see him on the rank list in the PIDS cardiology exam result. So it gives me immense pleasure to welcome Dr. Aditya Kamisetti. Who had an amazing rank 2 in the AIMS merit list and rank 3 in the common merit list in a very niche and very competitive pediatric subspecialty, that is pediatric cardiology, which I am highly betting on. Welcome Aditya. So how are you feeling after this amazing result?
Thank you, sir. Definitely delighted, and yeah, it's definitely a confidence boost. Giving a tough specialty and cracking it on a fresh attempt. It's definitely feeling good. Yeah.
Yeah, as you said, it was your first attempt, and that makes the achievement even more superb. So yeah, our viewers would like to know you more about you, like where are you from, how your academic journey has been.
Yeah, I am from Amlapuram, Konsima district, Andhra Pradesh. I have done my undergraduation from Andhra Medical College, Visakhapatnam, and I have done my. I am currently doing 6th semester residency in PGM Chandigarh. Yes, sir.
Great. So, like, firstly, let's go through your MD, like, because obviously taking and choosing peds cardiology as a subspecialty, that itself is a journey. So, let's little bit, delve into that. How did you make this decision of choosing peds cardio as your preferred subspecialty?
It's definitely tough, sir, because I like many subjects, especially gastroenterology, critical care, peds, hemato-oncology. All of them were great subjects. But why cardio piqued my interest? Because it was quite exotic, and in our residency, as such, we are not quite exposed to cardio as well, and it was always little bit foreign to us, especially in pediatrics rather than general medicine, and that exotic component is always there. And I have attended the peds cardio posting in my 5th semester ending, and it was I was delighted to watch all the procedures, and it was out of the world. Yeah, yeah. So yeah.
Definitely very fascinating, like especially from a pediatric perspective when we go into that, the suit of angiography, etc. It's very very nice. I myself had a posting there, and it was really fascinating. So then let's come to your preparation aspect, especially you're someone who cracked it through your MD itself. Like I specifically know how hectic the PG is at PGI, and while doing that itself you have got this result. So how did you plan I'm sure it would be not very specific to the exam, because you would have your MD final exam as well, but still you would have thought about what to do extra for this INI exam. So while doing your MD, how did you plan this preparation?
Uh, for cardio specific, I have done because I read my main source of preparation for my MD final exam was Nelson, and I used to attend our academic lectures in our college. But for cardio specifically, I made a point that I have to read entire Nelson for cardio, and I selected some niche topics like TOF, TGA, VSDs, and these are the common topics they usually touch upon in INISS cardio. So that I have tried to read from Moss Adams as well. And AIMS people usually like to give questions from other topics like Takayasu arthritis, and they like to touch upon the rheumat topics as well. So that topics also have read from Nelson, and I have done my MCQs from Dr. Tell's preparation, uh, residency and normal program, and yeah, so that's about it. I've asked my seniors how to go about. Just they gave me some tips and all to how to channel in the last phase of preparation after my MD, and before doing DM in last 1 week of preparation, how to go about and all. They told me how to see, and for the and I've read the Indian guidelines for the cardiology as well, pediatric cardiology, which was yeah, very helpful.
Yeah, like one thing I've seen most of our students who are getting great ranks touch upon is that the Nelson part of the super specialty that should be very thorough with. Like when
Yeah.
students, if there's some students going into, for example, reading Moss Adams first and then, thinking that Nelson is very basic, it doesn't work like that. Lot
Yes,
of
sir.
Nelson itself covers for most of the questions in the
Yes.
exam. So firstly, be thorough with Nelson, and of course there will be some special topics where they go in a little bit more depth that you can add on from whatever sources, along with your question bank practice. Also, I'd
Yes.
like to tell our viewers that Dr. Aditya was our DNA, the Doctor's National Assessment Test winner. He was, ranked one there, and that is how he joined doctoratorials, where he, as he said, the residency program by Dr. Sandeep Sharma sir, that also he was using with our platform. And coming to the interview part, as we can see, you improved your rank from your CML to AML, so you definitely did very well in your interview. So coming students, like, any guidance you would give them with respect to the interview part?
Interview, they'll usually ask the basic parts, and they won't go too deep into the topics. They expect you to answer from MD pass out level only. They won't expect very high level of answers. But you have to know, you have to, for Pete's cardio especially, you have to keep in touch with your seniors and ask them what all topics they used to ask, because mostly they will repeat the topics they usually ask, especially VSDs and TOF, TGA, VSD with pulmonary artery. So these are the usual topics they usually touch upon, and you have to read for other general topics like applied general, like acute traumatic fever and Kawasaki disease, and you have to touch upon the biostats as well. Biostats also very important for in keeping practical in mind.
Yeah, and also I wanted to ask you how the experience with DNA was like. How did you manage to do that, and how your that was?
Yes. By the time I gave my DNA quiz, I was nearing the end of my first reading of my Nelson and
Nelson,
Piyush Gupta.
great.
So I had rough idea about all the topics, but yes, it was interesting. DNA quiz was interesting. I got rank 3 in it, and
Okay.
yeah, and it was good.
Great. Obviously, quizzes are meant not just to go and win something, but also to refresh your memory, compete, and many times what we do, like what we attempt in the quiz, that stays with us, because that
Yes,
especially when we do something wrong, so that
yes.
stays like, okay, I had done that mistake, and that those questions stay with us, which are basically very important questions, right?
If it was
So
old, sir, yes, sir. If it
yeah,
was
tell me.
old, I wouldn't have appeared for DNA quiz. In my fourth and fifth semester, I made a habit ki I will appear for more quizzes, even though I won't win. I wanted to make sure ki I'll just appear. So I won pediatric critical care quiz in Chennai. It was very good. I met all the stalwarts of the pediatric critical care world, and we had pediatric hematology quiz. It was also very good. We won in it. So that gave me confidence ki okay, we can go to national level, and that gave me guts to attempt the DNA quiz in the first place. So it was nice. So we have to make sure ki in residency some form of academic to keep that competitive spirit on. We have to
Yeah.
appear for quizzes more often.
Yeah, I've noticed that the students who appear frequently for quizzes, they definitely do well in the entrance. I'm not
Yes.
saying all the toppers would be giving quizzes, but those who are giving quizzes, they usually end up doing very well in the entrance,
That
because it
mental
just
block is
yeah, mental block is gone. With you're just in that loop of studying, and sometimes because there's a quiz coming, we study a little bit extra. That also helps.
yes.
Yeah, and I think this particular question you might not have dealt with, but going ahead, if a junior wants your guidance with respect to NEET SS versus INSS, I'm sure you might not have thought about it much, but what would
Yes.
your guidance be to your juniors based on for that?
For NEET SS, I feel like all the topics are equally touched, and you can't possibly finish Nelson for all the specialties. So if you're thorough with your core MD preparation, I feel like you will do decently in the NEET SS. But it's not the case with INSS, I feel, because the
Definitely,
quota is
because
50, strictly 50 super specialty questions they give, and it's quite tough if you don't have the focused preparation towards that one particular subject. But you can do decently in NEET SS with your just MD preparation itself.
and yeah, let's guidance, something from you for juniors, because especially those through the MD, because a lot of us will be confused whether to give DM or not, if to give DM, when to take that decision, how to take that decision, and also through the preparation. Just a brief summary of what you would like to guide your juniors.
Regarding DM decision, I should not be the one to tell, sir, because I myself am confused. I'm still yet
No, it
to.
doesn't matter. You have cracked it in the first attempt, so it's not like you lost anything. Just 6 months more, and it's in your hands. So you have brought things into your court.
But I think it will come to you. People find their love in residency. It will naturally come to them. If you go to a department and you start genuinely loving the work without feeling that pressure or that weight of the work, if it's coming naturally to you, I think it's the one for you. That I felt with cardio and critical care. Eventually, I chose cardio.
Great. And what about a vote of thanks for everybody around you who made this possible apart from yourself for this, to get this achievement?
Sir, in my seniors, definitely I would want to dedicate this for Dr. Paritosh. She was very helpful for me. Dr. Paritosh and Dr. Jarin, they're both from critical care unit in our college. They both passed out. And in other departments, I would like to thank our consultants, Dr. RMK in pediatric, Rohit Manoj Kumar in pediatric cardiology. He has encouraged me very much to pursue pediatric cardiology. And Dr. Jayashree ma'am also has encouraged me very much. Even though she is critical care, she wanted me to do pediatric cardiology. She insisted to, do you want more peds cardiologists? So go ahead. Okay. They were very
Great.
encouraging. Yeah.
Great.
And I would like to thank my parents and my fiancée, Dr. Kirti Pai.
Yeah, great. So thank you so much. It was great talking to you. Great talking to you formally on this platform. Yeah. So, very well done. I'll meet you in Chandigarh maybe next week or so.
Yes, sir. Thank you.
Okay, Aditya.
Okay.
Bye.